Hello everyone. In today's topic, I would like to discuss you regarding ICDS, which is Integrated Child Developmental Services. So you can see here the name itself is saying regarding the program is regarding the Child Developmental Services. So coming to this ICDS program, this program was launched in the year 2nd October 1975, and if you see in India currently there were about 14 lakhs of Anganwadi centers which are working, and out of this 14 lakh Anganwadi centers, 96% of these centers are in operational. So if you see the aim of this program, the aim of this program is to focus on the preschool children. So mainly they want to see the integrated development of the growth as well as their mind and other activities. Mainly they are focusing on the children who are living in the rural areas, tribe areas, and as well as in the urban areas. So you can see here the aim is to provide services to preschool children in an integrated manner to ensure proper growth and development of children who are living in the rural areas, who are living in the tribal areas, as well as the children who are living in the slum areas. So this is the aim for this ICDS program. So coming to the main objectives of the program. So the objectives of the program is to improve nutritional as well as health status of the children who are at the age group of 0 to 6 years, because these are the preschool children. Next one is to lay the foundations of proper psychological, proper physical and proper social development of the child. So if you see the health education, there are mainly four dimensions here: physical dimension, spiritual dimension, and social dimension, and psychological dimension. So a child is, or a person is meant to be healthy person when all these four dimensions are met. So they, by this program Integrated Child Developmental Services, they want to lay proper foundations for the psychological aspect, physical aspect, social aspect and development of the child. And next one is to reduce the mortality, morbidity and malnutrition, and they want to decrease as much as the school dropouts. So if the school dropouts are decreased, automatically the literacy rate is increasing. So they are focusing on the mortality, morbidity, malnutrition and school dropouts. The next one is to achieve an effective coordination of the policy, mainly by implementation among the various departments who are working for the promotion of child development. And next one is they want to increase the capability of the mother and nutritional needs of the child through proper nutrition and through proper health education. So when a mother is having an awareness regarding the child nutrition, what is the proper requirement of the child, then those needs can be met by the mother through the proper health education to her. So that's what they are focusing on, the nutritional need, capability of the mother for the needs of the child, mainly through proper nutrition and proper health education. Next one, coming to the beneficiaries of this ICDS program. So the main beneficiaries are mainly the age group of the children who are at the age of 0 to 6 years. And next one is mainly they're focusing on the girl development, mainly the female child development who are at the age of 11 to 18 years, which are known as adolescent girls. So if you see here, the children who are below 3 years of age, they are receiving the supplementary nutrition, they are receiving the immunization, they are receiving regular health checkups, and they are receiving the referral services. And if you see the children who are at the age of 3 to 6 years, supplementary nutrition is given, immunization is given, health checkups are being done, and referral services and non-formal education, because this group which is 3 to 6 years is known as the preschool children, means before entering into the school. So that by this program their creative capability will increase, and all the nutritional needs which are required by the children at those age groups are met by the program. And next one is they are focusing on the adolescent group, they are focusing on the pregnant women, they are focusing on the nursing mothers, and also they are focusing on the mothers who are at the age of other women at the age of 15 to 45 years. If you see the adolescent age, so why there is need for the focus on the adolescent age means, as a female child there were lot of physiological changes which occurred in their reproductive system, and there is proper need for the proper nutrition. Why? Because as their physiological changes are occurring, and as they attain their menarche, there is lot of blood loss which is occurring. So in order to meet all those deficiencies, we have to provide proper supplementary nutrition, and through proper health education, the child is taught about the hygiene, regarding her personal hygiene, so that the diseases which are associated with those things can be prevented as early as possible. Next one is supplementary for the pregnant women. So they are giving proper nutrition, and proper immunization for the pregnant mother is very essential, because they want to prevent the diseases in the child as well as in the mother. They want to bring out a healthy child. And next one is health checkup, nutrition and health education. And mainly other beneficiaries are like nursing mothers. They are receiving the supplementary nutrition, they are receiving the health checkup, and they are receiving the nutrition as well as health education. And all the women who are at the age group of this 15 to 45 years, they are receiving the nutrition as well as they are receiving the health education. So these are the beneficiaries for this program, Integrated Child Developmental Services. So coming to the delivery of the services, so if you see here, they are taking the target group and they are providing the type of food or the food which is revised and financial norms per day. So the children who are at the age group of 6 to 36 years, they are mainly receiving the take home ration, because these children, they cannot stay in the Anganwadis, means preschool education. If you see the next group here, the next group is malnourished children who are at the age of 6 to 36. So they are giving the take home ration as well as additional 800 kilocalories and as well as 20 to 25 grams of protein, and the amount of financial benefit they are getting per day is 9 rupees. The children who are well nourished, they are getting an amount of 6 rupees, and the children who are at the age group of 3 to 6 years, so these children are brought to Anganwadi centers. So they are receiving the morning snacks, and also they are receiving an hot cooked meal, and they are receiving an amount of 6 rupees per day. And the malnourished children who are at the same age group of these 3 to 6 years, through proper health education, through proper health checkups which were done in the Anganwadi centers, through proper surveillance, these malnourished children are identified, and they are receiving morning snacks, they are receiving an hot cooked meal, and also they are receiving an additional amount of 300 calories and 8 to 10 grams of protein, and they are receiving an amount of 9 rupees. And coming to the pregnant as well as lactating women, these pregnant and lactating women, they are receiving the take home ration, and they are receiving an amount of 7 rupees per day. So if you see this pregnant woman in your homes, at your homes, if you find out any pregnant woman, these mothers are kept under surveillance. The Anganwadi worker will come to your home. The Anganwadi worker will check the mother. The Anganwadi worker will provide ration. So proper proteins are given to them. These mothers are giving proper pulses through ration, and they are receiving protein food items such as eggs and other pulses. So all these programs, all these are the services which are given by this supplementary nutrition service, which is embedded in this Integrated Child Developmental Services program. So if you see here, the supplementary nutrition, it is given 300 days in a year. So if you see the children, these children are weighed every month. So based on their weight, based on their height, and based on their anthropometric measurements, these children are mainly differentiated into first degree malnutrition, second degree and third degree malnutrition, and fourth degree malnutrition. So based on the degree of malnutrition, these children are receiving the amount of food materials which they are required. So they are giving nutrition, education and health education to the mothers. If the second and third degree malnutrition is present, supplementary nutrition is being given to those children. And if in case of fourth degree malnutrition, these children has to be hospitalized and they has to be recovered. So if you see, you can see here egg and other rice they are giving, pulses they are giving, and in some Anganwadi workers they will receive snacks, they will receive the chickpeas and other types of protein rich foods. So coming to the nutritional health education here. So nutrition and health education, the main target group is all the women who are at the age of 15 to 45 years age, and the main priority is given to the nursing women and expectant mothers during the home visits by an Anganwadi workers. So these nursing women as well as the expectant mothers who are ready to go for the deliveries, so these mothers are given nutrition and proper health education. Next one is immunization. So the children, all the children who are at the age group of 0 to 6 years, these children are receiving the vaccine for the preventable diseases such as polio, such as plague, such as tetanus, such as diphtheria. So all these diseases, such as all this disease can be prevented. So prevented through the proper immunization. So the child is ensured that he is receiving a proper vaccine, and all the expected mothers are receiving immunization against the tetanus against the disease tetanus. And next one is health checkups. So mainly they are doing the antenatal health checkups, and whatever the iron and folic acid is required and protein supplementation is required, it was given to the mother. And nursing mothers and other newborn children, they are receiving the postnatal care during the health checkup. And the children who are below 6 years of age, they are receiving the immunization during the health checkup. And the minimum 3 physical examinations are done for the during the antenatal care and after the postnatal care, and the children are monthly they will go for the physical examination, so that when there is any differentiation, when there is any abnormality which is noticed, it can be corrected. And high risk mothers means the mothers who are having risk for their delivery. If the mother is oligohydramnios, or if the mother is polyhydramnios, or if there is any kind of placenta previa, or in case of any kind of ectopic pregnancy or ingrown tumors, or if there is any kind of previous cesarean sections, so the mother is referred for appropriate institutions for the special care. Coming to the children who are below 6 years of age, so as I said, they are going for the record of weight and height of the children at periodical intervals. What is this? This is they are going for the anthropometric measurement, so that when there is any kind of abnormality, proper supplementary nutrition is given to the child, and they are watching over the milestones. And next one is immunization, and next one is they are doing the general checkup for every 3 to 6 months to detect any kind of diseases, and they are going for any malnutrition checkup. So whenever they are checking these diseases, or whenever they are finding out any kind of malnutrition in the child, so that the supplementary nutrition is given to those children. Next one is treatment for these diseases such as diarrhea, dysentery and respiratory tract infections, which these types of diseases are prevalent, and if in case of any serious conditions, these cases are referred to the higher hospitals. And next one is deworming and prophylaxis against the vitamin A deficiency and anemia. So if you see the previous program which I had discussed, which I have discussed regarding nutritional anemia disorders, you can find out the prophylaxis which is being done against this vitamin A deficiency and anemia. So they are maintaining the health records. These health records of the children are containing mainly all the details regarding the children and their antenatal care and delivery card, etc. All these things are maintained. So all these cards, if you see the health records of the children and antenatal care and delivery card, all these are maintained by these Anganwadi workers and the other helpers. And next one is this card is mainly containing the health record, as well as the child card is also given to the mother. So whenever a mother is coming to the immunization center, if you check the card, if the immunization is not done, and through proper confirmation with the mother, the immunization is received by the child. Next one is non-formal preschool education. So if you see this non-formal preschool education, mainly the target age group is about 3 to 6 years of age children. So the main objective of this program is to develop desirable attitude, values and behavior pattern among the children. And these children, they are given these locally produced items which are inexpensive and which will increase the creativity in the children. See, if you visit any kind of Anganwadi centers, you can find out their building blocks, you can find out their numbers, you can find out their bridge blocks which are used to construct. So whenever an target is set to the child, whenever a challenge is given to the child at this age group, the child will try to solve the puzzle, so that the creativity of the child is increased and the intelligent capacity of the child is increased. So this is non-formal preschool education. Here the children are not taught any kind of alphabets or things, but they are taught only the non-formal education, the initial stage. This is mainly focused upon the development, desirable attitude and values and behavior patterns of the child here. So what are all the list of schemes that are implemented? These are the schemes which are implemented under this ICDS program. So if you see here, we have Kishore Shakti Yojana scheme, nutritional program for adults and girls, and the scheme for adults and girls, and the next one is Pradhan Mantri Matru Vandana Yojana scheme, and also we have Anganwadi Services scheme, and we also have National Cricket scheme. It is mainly for the children of working mothers. So if you come to this Kishore Shakti Yojana scheme, the main age group is, the beneficiary age group is the age group of 11 to 18 years. So what are all the benefits that they are receiving means self-development, literacy, numerical skills and vocational skills. So all these are the benefits which are received under this scheme Kishore Shakti Yojana. The next scheme is nutritional program for the adults and girls. So what is the nutritional program means here? Mainly they are focusing on the undernourished adults and girls. So these undernourished adults and girls, if they at the age group of 11 to 15 years, if they are weighing less than 30 kgs, and the age group of 15 to 19 years, if they are weighing less than 35 kgs, so these girls are receiving 6 kgs of food grains. Mainly they are receiving per 1 month. If you see the scheme for these adults and girls, mainly they are checking the nutritional and health status. So the age group is mainly 11 to 18 years. Next one is Pradhana Mantri Matru Vandana Yojana. In this Pradhana Mantri Matru Vandana Yojana, mainly the beneficiaries are pregnant mothers and lactating mothers. So these pregnant mothers and lactating mothers, they are receiving the benefit in the form of cash transfer. Next one is Anganwadi Services scheme. So this was enhanced in the year 2008 at 1st October. So if you see this scheme, it is mainly focusing on the Anganwadi workers and Anganwadi helpers. So previously they used to receive an amount of 3,000 rupees. In main Anganwadi centers, the Anganwadi workers used to receive 3,000 rupees. But by this enhanced scheme, they are receiving an amount of 4,500. That is from 1st October 2018. In case of many Anganwadi centers, the Anganwadi workers received 2,500 rupees previously. But now they are receiving 3,500 rupees. Previously, all the Anganwadi helpers, they used to receive 1,500. Now they are receiving an amount of 2,250 rupees. And if their performance is better, they are receiving an incentives in the amount in the form of 250 rupees. Next scheme is Rajiv Gandhi National Cricket Scheme. So it is mainly for the children of working mothers. So the children of these working women who are at the age group of 6 months to 6 years, they are mainly if these mothers are working in rural and urban areas, so these they have to get employed for 15 days per month or 6 months per an year. So what are the kind of benefits that they are receiving means they are receiving daycare facilities, they are receiving early stimulation for the children who are below 3 years, and preschool education for the children who are at the age group of 3 to 6 years, and supplementary nutrition, growth monitoring, health checkups and immunization. All these are the benefits which are received by the children of these working mothers. Coming to the administration of this ICDS. So if you see here, the number of Anganwadi centers per population in rural or urban areas. So if the number of population is about 400 to 800, they are having one Anganwadi care center. If the population is about 800 to 1600, 2 Anganwadi care centers are established. And if the population is about 600 to 2400, there are 3 Anganwadi care centers which are available. And if you come to the tribal and riverine and desert and hilly and other difficult areas, so for every 300 to 800 population, there is one Anganwadi care center. So coming to this ICDS team. So this ICDS team, it mainly consists of a child development project officer, and next one is in charges, mainly supervisors, and 100 Anganwadi workers. So if you see this child development project officer, he will be guiding these 4 supervisors. These 4 supervisors are called as Mukhya Sevika. These Mukhya Sevikas, they will guide about 20 to 25 Anganwadi workers. So coming to the functions of these Anganwadi workers, mainly they will assist the child development project officer and all the beneficiaries. Next one is they will organize non-formal and education sessions which we have discussed earlier. And if you see here, they will provide nutrition and health education to the mothers, and they will assist the PHC staff mainly in case of providing the health services. They maintain the records of immunization, and they help in the feeding of preschool children, and they work for the other community based activities such as family planning. Coming to the functions of this Mukhya Sevika, functions of the supervisor. So they will act as a mentor, and they trains the Anganwadi workers, and they will assist in keeping the records, and they will go for visits of personnel and organize the community visits. So these are all the things which were carried out by this ICDS team. So this is regarding ICDS scheme and services. So if you have any queries, you can drop it down in the comment box, or you can ask me directly through my WhatsApp and through my email. Thank you so much for listening. If you like the content, please like, share and subscribe the channel. Thank you so much.